Hi, I'm Teresa Duncan.
And I'm Kevin Henry.
Welcome to Chew on This.
We are excited to bring you our views of current topics in the dental industry and put a little different spin on them, giving you something to chew on.
If you need to jump off, be sure to check the show notes for links as well as how to get in touch with us.
And now, let's give you something to chew on.
And we are back with another edition of Chew on This. K-Dog, what's going on?
Who are you? I can't tell who this is.
So for those of you who are listening to Chew on This and not watching us on YouTube, we are wearing these masks. We're wearing them because we both got to attend Speaking Consulting Network together. We don't get a chance with all of us to get together. So your lovely bride was there, Rita Zamora. I roomed with her, and you guys have your own little gang there in Denver, the Boulder Longmont area. And I got to crash that little crew. So it was really nice to hang. Yeah, it was nice to hang out with you. But at SCN, there was something you partook in. Is that the right word? Partook?
Yeah, I like it. Yes, I will.
Okay.
As the editor, I will give you a thumbs up on that. Yes.
Be a part of a murder mystery dinner, which is what these masks are from.
Exactly.
Shout out to Ashley Bond at Wisdom because she bought a whole bunch of them and distributed them. So why are we wearing New Orleans style masks? Kevin, please explain why we're wearing such a thing.
Well, because it was a murder mystery, and of course, we're hiding our identities here. You know, even though we were in Austin, it had a little New Orleans feel to it. The murder mystery was a lot of fun, and I've got to tell you, I was stunned who the murderer was because it ended up being one of the members of SCN. So,
and you did not think it was. You did not think it was that person.
I did not. I did not. Well, now you know what? I'll take that back. So, my lovely bride. You know, if there's a game, she dives head first into it. So actually, she's going around like really getting the interviews in on who did what. So she actually had this person pegged as the murderer. And I'll be honest,
you're kidding.
I'm dead serious. Dead serious.
Well, Dana is super competitive, so I can totally see her taking this seriously.
Oh, yeah. And power a couple of glasses of wine behind that competitiveness. And let me tell you, it's game on. There's no doubt about it. So
wine-powered Dana is something to behold.
Yeah, meanwhile, I'm just sitting there going, can I take the mask off yet? You know, so but she nailed it. She did a great job. And yeah, the Speak Consulting Network meeting was a lot of fun, great stuff. Enjoyed being there. And as you said, the highlight was absolutely getting to hang out with people like you. So very thankful for that.
Yeah, it was a good time. And even though we're road family, a lot of times we're hustling and bustling and going from here or there. So it was really good to have some downtime. We had, let me see, the biscuits from, I forget the place we were, but
yes.
Austin food does not disappoint because I had dinner with Rita Zamora and Janice Hurley and Karen Bennett one night, and the food was amazing. And then the next night, our friend Cindy Nygren came down from her house, and she took me to this barbecue place, and the ribeye was unbelievable. Austin just known, I mean, good food, a little weird, obviously, but good food. So
I'm going to put in a quick plug for Fix Southern House because that biscuit was absolutely one of the best things I've eaten in a long time.
Yeah. Oh, and the hush puppies. They had corn and crab hush puppies. And for this Southern girl, usually crab is not a hush puppy thing, but whew, that was good. Even Zamora was like, that's good. And she's hard to please.
She is. There's a high level, especially if it involves any form of gluten at all, you know, but she dove in, and I was really proud of her for that. So.
All right. So, Kevin, the real mystery is how you and I are keeping these masks on, and we're both blurry to each other because we don't have our glasses on. So I think it's safe to take the mask off, and because I got to see what I'm reading here. So here we go. We took the mask off.
Good point. All right.
Yeah. All right. I got to readjust my headphones. Hold on a second. Okay.
My goodness. Hey, there you are.
All right, there we go. Glasses back on.
That's better.
Feels like we got our regular uniform back on. All right, look at that. Okay.
Can we give a shout out to all the professional wrestlers who wear these things, you know, and they're doing this all the time. Seriously.
Can you imagine? Here I am just trying to read a news article with no glasses, and those guys are like doing suplexes and body slams with masks on. Like, I don't see how they do it. No. But yeah, this is this was not bad, actually. Oh, look, I should have just done that. It's so much easier now with my glasses on.
See?
Just hold it up the whole time. All right. Okay. Enough of that. So there's another mystery, though.
Ooh.
Let's go because we love to go around the world. We love to
The
go around the
world?
world. So we are going to Scotland, and
Okay.
that's not even the right accent. So I apologize. Okay. So there was a dentist that got shut down years ago
Oh.
for being dirty. And
No.
what I really love, and I suggested to you, let me go ahead and share my screen because I need to say, Kevin, that you need to work on your Dr. Bicuspid skills is what I'm going to say because
Yeah.
your titles have nothing on this multi-million-pound lawsuit against Dirty Dentist who sparked HIV scares to be dropped. Have you ever used the term dirty dentist on bicuspid?
No, but now I can aspire to new things. So
Yeah, I'm kind of
awesome.
feeling you got to up your game a little bit. So, okay, so let me just get into the lawsuit real quick, and then we have a really hot topic in
Oh yeah.
Minnesota to
Oh yeah.
discuss. Okay, so and a study. I love your study. So let's do this. Okay, so basically, this dentist sparked an HIV scare because he was dirty. He was struck off the dental register. 2016, 6,000 patients put at risk, Kevin, by using dirty equipment, and basically a whistleblower came forward in 2013. And what was really sad is that they ended up testing a lot of people, and 4 people tested. So all of those people, 20, actually not all of them, but about 2250 were tested for the bloodborne viral infection due to his actions. 4 tested positive for hepatitis C, but there's really no proof that that came from the office. So this gentleman here is not the doctor. This is one of the people who sued. His name is David Reed. And here's the thing: Scotland is not known for their litigation. If you ask anybody which country is the most litigious country, what do you think the answer is always going to be?
It's got to be USA, right? Come on.
Yeah, of course. I mean, we like to
Hello.
sue everybody, right? So they had about 800 people wanting compensation from this poor dentist, and the dentist like immediately was like, "Broke, I'm broke." Like
Yep.
he's out, so no money there, and they have exhausted. This is the thing. Thompson solicitors have had to reach out to all of the clients, this class action suit, and said they have exhausted all efforts, and basically because of there's no expenses to be recovered, that they should consider abandoning all of the cases. So this is not good news for people who like this David Reed, who says no justice has been served, and he blatantly cut corners. Um, this is sad. Let me just read this to you. He said, I will never forget when my grandchild asked my wife why her papa didn't love her anymore because he became distant when he wouldn't hug them because he did not know if he had HIV.
Oh.
No, that's
Wow.
really sad. So, just real quick here, a lot of people were saying that they had acute stress disorder, and they basically said that they could not tie that back to the doctor. So a lot of the like post traumatic stress and all that kind of stuff. And I got to say, I think that in the US, I think that there would be one lawyer around that would find a way. I just can't imagine that. I think this would have gone on for a lot longer,
Yeah.
right? Um, like there probably would have been some jail time, even that it doesn't even look like there's jail time. So I don't see this.
Yeah.
I don't see that that's happened. He basically just was struck from the register, lost his license, so that's kind of sad. Um, but Kevin, look at this. Look at this storefront.
Yeah, I was noticing that whenever you pull up that picture, and obviously that doesn't look too good to begin with. But
No, it's got for our people who are watching it. It looks like there was a nice white sign at some point. It's a small entrance. I'm talking small.
yeah.
What do you think that is? Like 10 feet? No, more than ten
Well, I
feet.
mean, the
Yeah,
lady
maybe.
walking past, I mean, I'm just trying to figure out based on her. Yeah, it's
It's
not
like
big.
about 12 feet wide. That's not a lot big space, and it's not a tall building, and it's a big metal door that's come down, so it really looks like a garage. But I think that's probably just to block from what is it called, theft and all that kind of stuff. But
Yeah.
looks a little sketch, doesn't it?
I'm not sure that's, a lot of places of things you got to go see in Scotland. I mean, just throwing it out there.
Yeah.
Yeah.
I think this is actually the equivalent of the white van that drives around. Like this is the dental office equivalent of the white van that drives around asking you to get in and get some candy type of thing. Like I don't know if I'd go into this office. It looks very,
I,
very sketchy.
I'm just wondering how long that this has been closed, because this looks like something you'd see in like The Last of Us or something.
Yeah, apocalyptic. It does.
Yes, I mean,
It does. You
or
are
maybe
so right.
Fallout. I've heard about that. So hey,
Fallout's a good show. I encourage you to watch Lay Fallout. Okay, so I have stopped the screen sharing here because honestly, that storefront is a little bit depressing. But what? There's no recourse for these poor patients. Which okay, so here I'm torn. So I'm torn here, Kevin. We have a system that allows pretty much you to sue for anything you want,
sure.
damages, all this kind of stuff. Plus you can leave reviews and like ruin people's lives and all this stuff. So part of me is like, man, these poor people, they don't get the justice. And then part of me is like, ooh, I've seen this go bad so many times. Maybe it's a good thing that there's not enough, that this guy isn't like, I don't know. But I'm torn because like we are so litigious, and over there that
We
seems
are.
like they not, I don't know. I'm
But
torn.
but correct me if I'm wrong. You said that they couldn't trace it back to that dental practice, correct?
I think so. And I'm
So
guessing it's because honestly, because it's been probably some time, like
yeah,
people get up to hijinks. You don't know if they spent time going and getting the old HIV on their own. You know, it's hard
it's
to tie
possible.
it
Let's
to
be
them.
honest. Yeah, yeah. There's just a lot of things, because I think back to some of the HIV, hepatitis scares that we've heard about here in the U.S. and kind of
Hmm.
what the result of that is. And as you said, we're a very litigious society, but we're also one that cases move very slowly. It is
True.
something that it's like years until something is resolved, especially
Yeah.
with appeals. And like you said, insurance may not be able to pay and all that stuff. So I'm trying to think of a case here in the US that really ended up well for the patients.
Not really well for the patient, but for the family, the Diamante driver case, I think
True.
they were
Good
able
point.
to get some compensation for that. And it ended up like really bringing attention to a big, big issue. So that's good. Um, but yeah, that's wild stuff, right? Like,
It
as
is.
you're right, though, it takes a long time. So that dentist out in your area
Yeah.
who poisoned his wife, I think he's been convicted, right? I can say he's poisoned her. Maybe
I
allegedly, maybe
yeah, I
allegedly
think we're
poisoned.
still alleged. I think we're still the allegedly part, but I'll look that
But
up while
you'd
we're
think
talking.
like
Go ahead.
there's an awful lot of like there were testimonies, there were all this stuff. Like you would think like it's a slam dunk case, but and I think that's why so many people go for the plea deal because it just gets them off the case. Otherwise, you've got 10 years, 7 years. That's a long time. Seriously, we should have been lawyers, honestly. Like, look how busy they are all the time.
We were just driving back in from we went up to Breckenridge over the weekend and drove the 2 hours back down the mountain into where we live. And Dane and I were commenting on all the lawyer billboards that we saw along the drive because, of course, you get hurt skiing or a big rig smashes into
Oh,
you, and so we were
yeah.
just commenting that, yeah, it's like the perfect scenario all the way across, because what just happened to you? Oh, well, hey, call us and we can take care of you.
Yeah. You know who has a lot of billboards? Vegas.
Oh, yeah.
When
Oh, Vegas
and
does. You're right.
and you know where I noticed it? I noticed it more leaving Vegas on the way to the airport. And I think it's because and they're big billboards and maybe like somebody's like, "Oh, I don't feel so good, man. My night at the club."
Uh-huh.
Yeah, I take a picture of the the billboard.
Well,
Get
we've
ready
all
to
seen The
sue.
Hangover. I mean, it happens, right? Come on. So, just
Mike
saying.
Tyson punched me in the face, man.
Exactly. I'm going to sue that.
Oh my lord. So okay,
Uh,
so let's go
well,
back. Let's come back to the US, the old
come on
US,
back.
and
Come
you've
on
got
back. So
some
we're still
stuff you
going to
want to
stay
talk
north,
about.
okay? Scotland's a little north, so let's stay in the northern United States here. Let's talk Minnesota. But before we talk
Mm,
about our friends in the lands of 10,000 lakes, I want to bring up a study, because you talked about stress a minute ago.
yeah.
And this study, which we will link to, of course, in the show notes, talks about this was done at the University of Gothenburg in I believe that's Sweden, or maybe it's
Gotham.
Germany.
Oh, okay. See, I just really like I thought you meant Gotham, like like
Well, see,
Batman
and
got
now I
him.
need to pull back out the mask. See, so, but here, let's look up Gothenburg, Sweden, not Gothenburg, Nebraska, for those of you listening, but Gothenburg, Sweden.
There's a
Um,
got what?
there is. I just Googled real quick, and there's a Gothenburg, Sweden, and a
that's
Gothenburg, Nebraska. So there you go.
that's a confusing identity for a Midwesterner, right?
Hey, look at the Gothenburg. Oh, Nebraska. Anyway, uh, so long story short, there was a study that was presented at the European Academy of Pediatric Dentistry in Gothenburg, Sweden, that discussed how children are very stressed by anesthetics injected into the mouth. I think you and I probably both know that, right? That's
I
probably a
mean,
stressor. I mean, let's
I
be
would be surprised to find a kid that's not stressed by that.
yeah, bring it on right there. Try it. Yeah.
Right. That kid we need to watch.
So, but apparently, according to the study, it's not just the little kids, but it is also teenagers too. So 14 to 16-year-olds were the ones that they really focused on this study. And one of the
Okay.
things that they did to see exactly how stressed they were was and I quote here, the participants were fitted with a device on one of their hands to collect data on hand movements and hand sweating measured via the electrical properties of the skin. So if your palms start getting a little sweaty, if you're, we've all been in the dental practice with the seat grabbers,
Oh
yeah.
yeah,
So
yeah.
see, so they
Ugh.
measured the seat grabbing, I think is what it boils down to.
Okay, so I had the misfortune of meeting someone a couple weeks ago or a week ago, and the handshake was just awful.
When
I,
the handshake's moist, that's a problem, right? I mean,
please don't say that word. Like, what can't? Isn't there a better word you can use?
not for
Just
this,
so,
because I know who it
yeah.
is.
Oh, I mean, and so like it's when someone when someone's face visibly changes when you shake their hand, like there's got somebody has to have told this person at some point, right? I'm sorry, I'm going off because you're talking about like body wetness and
Well,
all. It's
and
just like it
and
just
sweatiness.
describes.
I mean,
It's
come
just
on.
weird. Is it sweat or is it just is he clammy? I just don't get it. Like
Is there a
so, but
difference?
I
I'm curious.
oh well, clammy. So he's not the hot handshake wasn't hot and sweaty. Like I'm shaking a jogger's hand. It was just it was clammy. That's the word
Well,
for it. It was
I agree.
clammy.
And
So I had the urge to go wash my hands and I didn't made sure to not touch anything like I was putting in my mouth or food until I could get to the bathroom because it was really
yeah,
and
you know
you'd
what?
warned me. You'd
I
warned me.
see
And
that's the thing. And this person shall remain nameless, but I will say that
yes, of
this is
course.
somebody who that every time I have shaken this person's hand, it has always been in the same condition. And I've never gone afterwards and gone, you know what I'm hungry for now? Wings or French fries or something just I need to eat with my hands. You're exactly right. So no.
All right, so enough of this clammy
Yeah, that's
person. He shall now be known as the clam. That's how we're going to refer to him.
and I've
Okay, so
learned now. And I've learned now I can't use the M word around you just like I can't my daughter because that just creeps her out completely. So
yeah,
anyway.
I don't like it. And then there's the word that starts with P. That's the other, and don't say it. The other word for women's underwear. So don't
Oh,
say it.
okay.
I
No, I
like
won't.
it's just it gives me the ugh, like
Oh,
the
okay.
icks. Yeah, I
Yeah.
get the icks with it. So
Okay.
I don't like it. So
Well, you know what is giving some people the icks right now?
look at you. He's such a
I'm gonna tell you
professional.
like that.
Segging back in. Okay, go ahead. Go
Bring
ahead.
this back in. And that is we've teased Minnesota now for a little bit, and our friends up in
Mhm.
Bemidji are going, why aren't you talking about us? So here we go. Let's talk about what's going on up in Minnesota. And I will be honest, this is one that you kind of brought up to the front, is that there are some changes going on. We're talking about the nervousness of teens with dental injections, with dental anesthesia. And we are now at the point when the state of Minnesota where dental assistants will be allowed to give some injections
With
and
some caveats though,
with
with
some
some
caveats, which
qualifiers.
yeah, which I'm definitely going to run through here. So I'm reading this directly from Minnesota.gov or mn.gov. We'll link to this as well, just so that you'll see what I'm reading. But dental assistants in the state of Minnesota. This is, and I'm reading direct quotes here. Before administering local anesthesia, a licensed dental assistant must provide the board evidence of at least 1 year of experience in general chairside dental assisting, evidence of completing a board-approved didactic and clinical course at a school accredited by the Commission on Dental Accreditation that requires clinical competency in the admission of local anesthesia, evidence of passing a board-approved, nationally recognized local anesthetic examination, and evidence of application for local anesthesia certification through the board. So, as you and I were talking about before we came on the air, and you know I'm a huge proponent for dental assistants and what they can do in the practice, but this, according to Minnesota, 1 year of experience plus completing these various courses, all these different exams, everything else, and you are set in Minnesota to place some anesthetics.
Yeah. So usually you and I agreed on this. We are big fans of assistants, very undersung heroes in the office for sure. So, but this gives me pause. I am referencing back to your study. People are already nervous enough about getting a shot, right? And
Yep.
so now you've got, so say I'm an assistant and I meet the criteria, I take the class, and I want to talk about the class in just a second. You've been seeing me chairside as a patient. You've been seeing me chairside. You've been seeing me clean a room, all this kind of stuff. And now, like, I'm coming at you in a nice, gentle way with a needle, right? I don't know as a patient, are some patients going to get freaked out, or will patients do what patients do and just not notice that anything's weird? So for me, I would notice it, but most patients, I don't know if they would.
But I'm also going to flip it, because one thing that I always talk about with my dental assistants whenever I'm out there is how much they are trusted by the patient, how much that they are often seen as the equal. So is it something that, because they're trusted, could the dental assistant, could that lower the stress level with the patients? I don't know. I mean, it's a two-sided coin. I'm not really sure. And I know everyone is different, but I would be curious to know about that.
So, I mean, that's a great point. You're absolutely right. As a former dental assistant, a gazillion years ago, I always was impressed with my doctor's technique on giving injections. He was always really good at talking them through it. And, he hid the needle until the last minute. They really didn't even see it. So I think good assistants are probably going to mimic that and be able, to use those tones. And they are mostly they're the ones who comfort the patients anyway. So, I mean, that's a great point. That's a great point. Some of the objections that I've read online, because some of the Facebook groups, as are predicted, were not necessarily welcoming of this, the dentist heavy Facebook groups. And even some assistants I saw pipe in and say, we don't want this, but let's talk about that in a second. They were very angry and bringing up the fact that they had to take years and years of anatomy and physiology. And then, because you've got to know about the interactions, the acid and the base, and the, and the anesthetic with the body. I mean, I'm just going by the little I know. You have to know that stuff. And then they have to take lots of classes. And so really they're feeling like one class, which we'll go over what's included in that class. One class should not be enough. Right. So I don't know. I'm torn, because also there's not a lot of, hygienists are, so basically, I'm assuming that in Minnesota, hygienists can give anesthetic, because honestly, if the assistants can do it and the hygienists can't, that's crazy. But you and I didn't look into that. So,
No.
caveat there. But I know in the states where hygienists can give anesthetic, it's such a helpful thing for the offices. The doctors, honestly, in our office in Virginia, our hygienist gave more injections most of the time than the doctors did. She was just always free and he was going back and forth.
And that's a really good point, because we talk about the short staffing in today's practice. We talk about all these different things that people need to be cross-trained in. And often that's the front versus the back whenever we talk about cross-training. But this is something, Minnesota has always been very progressive whenever it comes to their dental assistants. It's one of the reasons why the dental assistants in Minnesota are always either number one or number two whenever I look at the average pay per hour for dental assistants. It's always Minnesota right up there at the top. And also, if you look at, and one thing that I do is I look every year at, there's a study that comes out from USA Today about the healthiest states in the United States. Minnesota is always up there as well. So,
Yeah.
I think that there's some kind of relationship between that, between oral health, overall health, what dental assistants can do. But this is a big step, and I think it's one that is definitely going to be taking care of a lot of people focused on what happens here and can it happen in our state. And I think a lot of people will
Yeah.
sit back and watch that.
Well, I wanted to very quickly here, if I could, just go over like what it is that's included.
Yeah,
Just
please.
because I think that would be very handy for us to kind of go over with the audience. And we're not going to do a full thing of all of the classes and stuff, but I just want to do a quick. Can you see that, Kev?
Yes.
So it's a 45-hour training program, and the University of Minnesota already has it up and open for registration. So 25 hours of didactic instruction, recorded and Zoom, and reading Quizlets and worksheets. So that's not in person, I guess. It doesn't seem like it. And so introduction to local anesthesia, there's the recorded lecture, reading assignments. So there's pharmacology and neurophysiology, which this is the issue. I know you know this probably, but just for people who maybe are newer to dentistry or haven't been assisting very long, there are definitely cases where it takes a long time for a patient to get numb.
For sure.
And a lot of times that's because there's an active infection or it's the patient's makeup. Like some people just take forever to get numb.
Absolutely.
I was talking to a friend of ours who actually just had a root canal. I'll tell you afterwards. And he said that he has this thing where they actually don't, he might have to just go get numb because they put so much anesthetic in him. And he keeps telling them, look, my body makeup, this has like been proven. And they never believe him. If you keep giving too much injections, it can be too much for the body. But if the infections are very acidic, Kevin. So that's the nature of that's what's going on in your body is when you have an infection, there's a lot of acidity there. And so the anesthetic is basic, right? So that's supposed to cancel it out. But sometimes if there's too much, you have to just keep injecting and injecting and injecting. And that can cause problems with the whole body, the whole system. Then you need to give them something to counteract that if you're having actually issue in the, you have to do some buffering there. And that's something that I know my doctor was always like, oof, we're not, you know what, I'm not taking any chances here. You're not getting numb. I'm sending you to a specialist because you get into a lot of risk. And that was something that was brought up on the Facebook groups is who's carrying the liability here. It's always going to be
Right.
the doctor, even if the assistant has it, right? Okay, so they go over complications management. And then part B, at home or workplace clinic 5 hours. This makes me nervous. It's the injection experience. And for these assignments, it says, it's right here in the thing, you will need to borrow a syringe, cartridge, and needle from your place of employment. Participants must also purchase one bone-in piece of chicken. I'm a little nervous that that's anywhere in a dental school curriculum, right?
Yeah.
So, okay, so let's keep going. Then 15 hours of on-campus hands-on injection. Okay, that makes me a lot better, right? So you're practicing at home, and to be fair, implant dentists practice on pigs' heads. So pig's head, bone-in
Oh, yeah.
chicken, whatever.
Absolutely.
Then there's, I guess, a test, and then they wrap it up. So I guess they wrap it up. I'm not seeing an exam, actually, now that I'm thinking. I don't see an exam on here, Kevin. It looks like it's just a training program. Okay, so that's a little
Oh,
weird too. Okay, let me come back to you here.
yeah.
Okay, so all that being said, it sounds like it's a very intensive program. It looked like I think it was like $3,000 for that, and I'm sure employers are going to pay for that, which is fine.
Of course.
Does add to the skill level, but I don't know. It's
I,
so new. I'm just having a hard time with it.
I think with everything, there's a lot of risk. And I think, you mentioned the doctor's license. You know, the dental assistant will now have more responsibility in the practice, but he or she will also have more risk involved
For
as
sure.
well. And
Yeah,
so
for
I think
sure.
that is something that you'll need to figure out. If you're an assistant, do you want that risk? If you're a practice, do you want that risk? I know this, like I said earlier, this is going to be watched. And good, bad, whatever, it's going to be watched by other states. I'm all for dental assistants being able to progress their careers, try new things, but I'm very worried about they have to be like, the training has to be so in place and so spot on. And whenever I was reading a minute ago, let me just go back to that because it really struck out to me. The evidence of passing a board approved, nationally recognized local anesthetic examination. We know that there are going to be a lot of choices for that out there. Some are going to be better than
Mm.
others. That's what concerns
Mm.
me a little bit is the
That's a good
level of
point.
that exam actually being passed, where that comes from.
Very interesting. Well, and one other issue too that we saw when in the readings, and I should have mentioned this too, is that there's three different kinds of anesthetic that I'm familiar with, and one is the nerve back here, which affects the lower jaw. And basically, if you've ever had a nerve block, it numbs your whole jaw. So it's one shot down by up by the nerve. Kind of, and for those people who are not clinical, it's just kind of where your jaw comes together, where it articulates up by the ear. So there's the nerve block there, and then that numbs your whole lower. Then you have on the upper and anywhere in the lower, like this infiltration where you just kind of go directly to the tooth. And then there's what they call a field block, which is where it's on the lowers. It's not the nerve block where everything's blocked on that side, but it's like basically sprinkling anesthetic over a larger field.
Yeah,
Okay. The nerve block is not included in this legislation. And that is one of the first things I looked at. Remember in the pregame, I was like, block, 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 wait, block. Um, and then when it said field block, that made a lot more sense. So nerve block is where all of the legislation, I mean, that's where all the, not legislation, the legalities, the suits and everything.
for
Because
sure.
when you have, if you get that wrong, there's permanent nerve damage and people lose feeling, all that kind of stuff. You know, one lady, I remember one case, she lost feeling completely, and it affected some sort of saliva gland over here too, and she like had constant drooling, and like I can't even imagine. At least there's no nerve blocks, I guess, is my where I'm feeling a little bit better.
I think with, one of my grandpa's favorite sayings always comes up with choices come consequences. And the good
Mm,
or bad consequences, there's still consequences. So if
sure.
this is something that you want to have in your practice, I think you've really got to think through all of the what ifs. And you've
Hmm.
really got to be prepared to explain maybe to patients, yes, Dr. Smith normally does this, but now Teresa is able to do this. And isn't that wonderful? And Teresa's been trained. And really, while they may trust Teresa to be an assistant, really make sure that they understand that Teresa's taking her career to the next step. And kudos for that. I love that
Right.
part. But I think that there's going to need to be a lot of patient education in there as well about how much that Teresa has trained and absolutely this is safe and all that.
Yeah. Yeah. It's a, I feel like we're kind of, in a brave new world. I was not surprised when hygienists got the ability to do anesthesia. And some people argue, well, they only had 2 years of school, so really, what's the difference? But I feel like it's a different level. I mean, there's a lot more focus
Yeah,
on that. But we've met some rock star assistants. So we will be watching this carefully. I know Dr. Bicuspid is going to be covering some stuff
for sure.
on that too. So we'll keep you informed here. So that being said, Kevin, next time I see you, you want to let me practice on you? I've got some mad clinical skills.
I've heard your tales of dental assisting, and I love you dearly. But I think I'm going to pass this time. I think I'm just going to go eat
How
my chicken wings, and I'll be okay. So
how dare
I
you?
know it
And that's
hurtful.
probably
I
the
know.
smartest thing you're going to say all month because Kevin knows I have stories. I was a terrible dental assistant. It was bad. So luckily my doctor realized that I could be used elsewhere. So whenever I hear people talk about you got to put people in the right seats on the bus, boy, I was in the worst seat possible. It was terrible. So
Uh,
God bless my old boss. So all right, K Dog. So we went to Scotland, we went Minnesota,
yeah,
and little stop in Nebraska, I think, just
yeah,
a tiny stop in
yeah. Shout
Nebraska.
out to all our listeners in Gothenburg, both Sweden and Nebraska, for sticking with us. I mean, that's
I
fantastic.
love it. We actually have a lot of talking about Sweden. I really need to get a clip of the Swedish chef making noise because we somehow talk about Sweden a lot.
We do. we have a dear
meatballs.
friend who's in Sweden right now as we speak. So, maybe he'd bring us back some meatballs or something.
Meatballs. That's actually Italian. I don't know why I'm saying it like that. So,
we got to work on your accent game. I'm just telling you today.
Just like my assistant game, my accent game, not great. So, all right, dear listeners, as always, thank you so much for spending your time with us.
And that's a wrap for this episode of Chew on This. We hope you laughed and learned a little.
Check out the show notes for any links we mentioned, and don't forget to give us a rating on your podcast app. Feel free to drop us a comment on social media or by email if you have any suggestions for future topics.
We'll be back in about 2 weeks. See you then.